Welcome back. This is Talk with Audrey. Joining me now, Dr. Regina Benjamin, the 18th Surgeon General of the United States and a member of the American Heart Association Board of Directors and founder and CEO of Bayou Clinic, Gulf States Health Policy Center, and Bayou La Batre, Alabama. We're going to talk today about why COVID-19 and cardiovascular diseases, including strokes, are affecting African Americans, U.S. Hispanics, and rural populations at disproportionately higher rates. Welcome.
Thank you. You pronounced Biobattery pretty well.
Did I? Thank you. Woohoo! Well, thank you. And it's also nice to be able to smile during this time, I have to tell you, because there's not a whole lot to smile about. So, Dr. Benjamin, African Americans, U.S. Hispanics, and rural populations are at a higher risk of suffering complications and death from the coronavirus, correct?
That's correct. You know that when we first started talking about the coronavirus, we talked about people with being elderly and the chronically ill were at higher risk. Well, in the minority populations, we see more diabetes, high blood pressure, we have underlying heart disease. These are things that are also chronic conditions. So it wasn't really surprising that we started to see coronavirus start to rise in this population. What we were surprised to see was that the patients were coming in much sicker, they're getting sicker faster, and they're dying more. And so that in itself is frightening. The American Heart Association has also been noticing people with underlying cardiovascular disease, particularly around cardiac arrhythmias or irregular heartbeats, are also being affected more. And so we have established a $2.5 million rapid research fund to fund researchers to try to find out how we can prevent or what the implications are of coronavirus on cardiovascular and coronary cardiovascular disease, as well as the irregular heartbeats that you see.
So my question is why? Why are we at higher risk, and why is this impacting minority communities at a greater rate? I mean, clearly there are some underlying health conditions, but why?
So we have been looking at health disparities for about 20 years. I mean, it's not new. It's been around. The National Institute of Health has their National Institute of Minority Health and Health Disparities. So there's research going on around the country at the academic health centers. And out of that, we've learned a few things, mostly around the social determinants of health. We know that your education status really affects your health. The death rate for people with less than 12 years of education is 2.5 times higher than those with a high school diploma. We know that your financial health is very important to your physical health. Having access to health care, having access to clean air, clean water, all of those things impact your health. And many of the minorities live in places where we don't have those. We know through the research that your zip code is a better predictor of your health outcomes and your long-term health than your genetic code. So when you look at that and you see all of these things happening, you also can say it's not just genetics, or it's not just being African American or being Hispanic. When we look at rural populations, we see the same thing, because we see more obesity, heart disease, high blood pressure, all the things that contribute to cardiovascular disease. And so we're starting to see this rates rise there as well.
When it comes to health disparities, is this something that you're seeing across the United States?
Now, what you're getting at is the same, is those social determinants of health. Those are things that are often outside the individual's control. Can they find healthy foods? Can they find affordable healthy foods? Do they live in areas that have clean air and clean running water? Those things really do impact your health. So there are certain things that we can try to do, but some things are out of our control. You're seeing things like stress. We know that stress is a major component. And many of our communities are very stressed. And we're seeing that as a whole society right now because of the coronavirus. We're all stressed, and we can appreciate that. The fear that's in society, the people who don't know whether they're going to have a paycheck or they're out of work, or if their kids are at home, how they're going to get daycare for them if they have to go to work. Those are major stressors, but people in poor communities have been dealing with this for a long time. And hopefully we'll have empathy around that and understand it a little bit better as we start to make our public policies.
And what steps can people take to improve their own health outcomes?
The things that we always talk about, I talked about as Surgeon General, I still talk about. I think it's important, particularly while we're in this particular, going through this pandemic and this crisis. We need to follow what is, told to us by the professionals, by the doctors, by us in healthcare, that you wash your hands. You wash your hands. The more you wash your hands, the better. Your chances are decreased. Wear your face mask to protect yourself, but also to protect others, that you don't give it to someone and you didn't even know you had it. Protect those people who are at risk, that are out there working in those essential jobs for us. Many of those come from the populations we're talking about. The keeping the grocery stores open, our policemen, our nurses, our healthcare workers, people working in the nursing homes, all these people who are going to keep things moving. We need to do what we can to protect them as well. Those of us at home can exercise, try to, even though we're sheltering in place, try to get as much exercise as possible, find some creative ways to start to exercise, put on a old record with your friends or whatever, but find some ways to be creative and exercise. Try to eat healthy, as healthy as you can, as healthy as you can afford. Get enough sleep. Try to make sure that if you're having mental health issues or behavioral health issues, seek help. Call a friend. Don't try to go it on your own. Don't smoke. Don't vape. Don't use tobacco products. While all those things sound pretty simple, they really do matter, and they can make a difference, and they can actually save your life.
Great advice, Doctor. So, as you've heard, I know that you're hearing this again and again and again, but we're going to continue to drive this message home. Informed is empowered. You've been informed. Empower yourself and your friends and family with information, and stay safe. Dr. Regina Benjamin, thank you so very much for joining me.
Thank you. And if you want more information, you can go to heart.org. There's tons of information the American Heart Association has on the website.
And I'll be right back after this.